Welcome everyone to today's webinar, A Proactive Data Security Strategy for Health Systems, Tips for Prevention, Maintenance, and Recovery. I am Ayla Ellison with Becker's Hospital Review. We will begin today's webinar with a presentation and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. We are looking forward to hearing your questions. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. At this time, it is now my pleasure to start today's webinar by introducing our presenters. Ray Purcell is the Director of Compliance for Ensemble Health Partners. Ray came to Ensemble from Banner Health, where he had been serving as Banner University Medical Center's Compliance Officer. Earlier in his career, he served as the Corporate Privacy Officer and Compliance Officer for a national revenue cycle company, which had team members in several hospital systems in over 40 states. While there, he oversaw the HIPAA privacy and compliance programs. Ray earned his master's degree in business from Western International University. He is certified in healthcare compliance with the Healthcare Compliance Association. In addition, Ray recently received his certification as a certified revenue cycle representative with the Healthcare Financial Management Association. Greg Kerr is the Chief Privacy Officer for Ensemble Health Partners. Greg came to Ensemble from Incura Consulting Group, where he had been serving as a managing director. Earlier in his career, he served as the Corporate Privacy Officer for a national publicly traded healthcare system which owned and operated hospitals and employed physicians in multiple states. While there, he implemented the HIPAA privacy and HIPAA security compliance programs. Greg earned his master's degree in health law from the Loyola University Chicago School of Law. He is certified in healthcare compliance and healthcare privacy compliance with the Healthcare Compliance Association. Greg speaks regularly on current HIPAA privacy topics at both regional and national conferences and is a member of the active faculty for the HCCA Basic Privacy Academies. At this time, I am pleased to turn the floor over to Greg to begin today's presentation.
Thank you very much, and good morning. We would like to thank Becker's for inviting us to do the presentation this morning, and also would like to thank each and every one of you who have joined us in the attending of this session. Before I turn the presentation over to Ray, I wanted to give the following disclaimer regarding today's presentation. All incidents discussed today have been derived from the OCR website and are available to the general public. Our comments are not considered legal advice, but rather they are developed from many years of working with HIPAA and breach notification rules to assist organizations to comply with the various requirements for breach notification reporting. Thank you all very much. Okay, Ray, I'm turning things over to you.
Good morning, everyone, and thank you for taking time out of your busy day to join the session. Today, we're going to talk a little bit about HIPAA breaches, how to prepare for one, what to do if you have one, and what to do afterwards. Second part of this presentation, we're going to talk about a little bit about business associate agreements. Who needs one? When are they necessary? And things to look out for. Having said that, our learning objectives for this session are as follows. The importance of being proactive about data security. With all the recent examples of large companies having data breaches, Targets, Home Depots, etc., it may not be if your organization experiences a breach, it might be just a matter of when. How information security is a dynamic process that must assess risk to EPHI on an ongoing basis. With all the moving parts and the newest sophisticated ways your data is trying to be accessed and stolen, your IT team must always try to be one step ahead, if that's even possible. If you have a breach and end up having to report it to the media, we have some strategic insights to navigate interaction with the media so that protected health information is not disclosed. Finally, with business associate agreements, there are methods to assess when a business associate agreement is necessary and the obligations of the business associate throughout the life cycle of PHI. So as I already mentioned, it may not be if your data is breached. It might be just a matter of time when it is. Having said that, the best time to minimize your risk is before it happens. A well-defined process ahead of time can serve many purposes. It can provide your organization a game plan on how to handle the breach, the necessary steps to see through it as well. Nowadays, these game plans are a necessity. Anyone that has gone through a breach can attest to that this is vital. So prior to a breach, it's recommended you complete an annual privacy and risk assessment. These risk assessments can be done internally, or you may consider having an outside vendor complete the risk assessment for you. There are several reputable vendors out there. Oftentimes, organizations will, the first year, do an internal risk assessment, identify the gaps, and try to resolve as many issues as possible. Then the following year, contract with a vendor to complete another risk assessment. If you engage an outside vendor, it's imperative to be honest and forthcoming. They're there to help you identify risk areas, not to be judgmental of your organization and what might be lacking. If you're doing an internal risk assessment, this may seem obvious, but you must include key stakeholders within your organization to be involved. However, sometimes the struggle is identifying those key stakeholders. One of the first things to do is create a plan to evaluate privacy and security incidents. Determine the circumstances surrounding the breach, the nature of the unauthorized disclosure, the type of data involved, review the regulations, and determine what the potential level of harm is to the affected individuals. Another valuable tool is to develop a breach response plan prior to a breach. Clearly, each incident can be different in nature, but having a breach response plan can save a lot of time and headaches. Ensure you have identified your internal stakeholders to help in this process. Keep in mind, depending on the nature of the breach, you may seek outside help from a vendor if you do not have the capabilities in-house to address all the necessary steps to resolve the breach. Some of the steps include completing a forensic review if necessary, mailing out notifications to affected individuals, establish a call center for those affected individuals to call in, and trust me, they will call in, and you may have to offer credit monitoring. A lot of healthcare organizations do not have the capability to handle all these functions, so why wait until after a breach to get all your ducks in a row, especially since reporting timeframes are in place. As you go through this exercise with your organization, you may need to create new policies and or procedures and or update current policies and procedures. One very important thing to keep in mind, though, is it's vital to keep abreast of the federal and state reporting requirements. This can be difficult, especially if your organization operates in many different states. Okay, so I'm going to turn it over to Greg now, and he'll walk you through what to think about and what to do during a breach.
Thank you, Ray. So during a breach incident, these are the times when tensions can be very high. And as things and information becomes available and details unfold, it is not uncommon that knee-jerk reactions can occur. And these type of reactions to information that's uncovered can be not only costly, but it can also create additional complications for the organization. So it's very important that individuals work quickly and swiftly to gather the facts and make the information and individual interviews with the stakeholders and get everyone's information that is involved with that investigation process. Having that information collectively provided does help to develop a response that is going to be proportionate to the types of information that need to go out for any kind of necessary reporting obligations. It's important that at the beginning the investigation process is handled in almost a forensic investigation manner. You want to determine the nature and the severity of the incident and document the findings. Being able to document the findings will help you with any kind of regulatory investigations or a potential class action type litigation in the future, or as other issues unfold with the investigations, being able to refer back to those documented information pieces will be extremely helpful to the organization. Also, you want to determine if there really is a notifiable breach. One of the many things you want to start looking for, and first and foremost, is looking to see who are the affected individuals. Is this something that OCR would need to be notified of? And is there any kind of state reporting requirements for any regulators in your particular state or a state where an individual that is affected in the breach would reside? It's also very important to know the timelines and the residency of the affected individuals. One of the most important first steps in looking at incidents that happen once you find there is a breach is to ascertain the number of patients and the locations and states where those patients or affected individuals reside. Media and substitute notice can also come into play if the breach of your organization would contain 500 or more affected individuals. And substitute notice comes into being if there are more than 10 individuals for whom you do not have current information or contact information for those individuals. Also, it's a time to start looking at your policies and systems to determine if there are any particular policies or any systems that need some type of remediation at your organization. Also, the last bullet talks about the need for credit monitoring or identity recovery services. And again, you want to look at the scope and the type of information that has been disclosed and the individuals who are affected to make those type of decisions, or at least begin planning that information early on. A breach risk assessment is something that is necessary to determine whether or not this will become a reportable breach. And in the definition in the first bullet I have listed here, a breach is an unauthorized acquisition, access, use, or disclosure of unsecured PHI that violates the HIPAA privacy rule. And in the eyes of HHS and OCR, any breach is presumed to be a reportable breach unless the covered entity or the business associate could make a determination that there is a low probability that the PHI has been in some way compromised, or this breach and the incidence of that breach would be able to be placed within one of the exceptions that have been outlined in the breach notification rule. So in order to develop that breach risk assessment, which is something that should be done with every breach incident on file that the covered entity would not be reporting to either affected individuals or state or OCR, the type of elements that need to be included in that risk analysis include whether or not, first and foremost, is there a violation of the privacy rule by the type of incident that has occurred? Does the violation fit with any of the breach exceptions? And is there a low probability that the data has been compromised? This type of information also needs to be reviewed for the type and the amount of PHI involved. In other words, having a patient name and address disclosed with no attached medical information would be viewed differently than if there is a name, total demographics, a social security number, date of birth, and medical information release. So again, depending on type of PHI involved and the scope of that disclosure would determine whether or not notification would be required. Also, knowing who the unauthorized person is who both impermissibly used or accessed the PHI or to whom the disclosure was made is extremely important to be able to make a determination, especially with the breach exception issues. You look for whether or not the PHI was actually acquired or viewed, and whether there's any risk that the PHI, any risk to the PHI occurred, and has that risk been mitigated or not. At this time, I'm going to turn back over to Ray so he can make some discussion points about reporting requirements.
All righty, thanks, Greg. So once a breach is discovered, notice to the affected individuals must be provided within 60 calendar days of the initial discovery. This 60 days is required by the Office for Civil Rights. However, keep in mind your individual state may have restrictive reporting timeframes. This is very important. If more than 500 patients are involved, notice to the OCR and media outlets is required. So 500 or less, you're not obligated to report to the media the breach, but you must report it to the OCR on an annual basis. The clock starts ticking when a breach is known, not when it's reported to you. If there is a delay, it's not at the conclusion of the investigation. And I have an example of that coming up here in a second. So in a previous job, what would happen is, let's just say a team member on a Monday would discover a breach. Let's say that they did the breach, and they forgot to report it on that Monday. Then at 4 o'clock on a Friday, you're packing up, getting ready to go home. You get that dreaded call that starts out with, is it a compliance issue if, and then they proceed to inform you that they accidentally sent, let's say, 550 medical records to Joe's garage instead of St. Joe's Hospital. The clock technically started ticking on that Monday when the team member realized that they made the error. Now that the weekend is right around the corner, chances are that your key players are off for the next couple of days, and that will significantly delay your ability to complete the investigation. Although the OCR has a 60-day time frame to report, what if you were in a state that has a 10-day reporting time frame, or worse, a 5-day reporting time frame? This does not give you enough time to complete your investigation and risk assessment if you are just now being alerted to the potential risk or the breach, let's say, on a Friday at 4 o'clock. The other important thing to keep in mind is what time frame is in your business associate agreement. I've seen 60, 30, 10 days, 5 days, even just immediately. As I said earlier, it's important to have a game plan in place to address these types of issues when they come up. One helpful piece of advice is to have parallel tracks, one preparing to notify the affected individuals and another track to conduct the investigation, I should say. This way, if it's determined there is a breach, the process will be a bit smoother and you will have greater chances of meeting the necessary reporting timeframes. When it comes to reporting to the OCR, the time frame is 60 days, not 61 days. Even if an investigation is still ongoing, the OCR will not make an exception to the 60-day requirement, except if it's involving law enforcement and they're requesting the delay due to impeding criminal investigation or a threat to national security. Some advice: your organization should instruct employees to report any suspected breach immediately. I've always stressed this in my previous jobs. Whether you think it is or isn't a breach, please report it ASAP and let the compliance officer, the HIPAA officer, the privacy officer, let them make that determination. This is crucial to help avoid that 4 o'clock on a Friday afternoon call saying, hey, is it an issue if? So here are a couple of, here's an example of an organization getting fined for lack of timely notification of a breach. This should help reinforce your position within your organization to have a breach response plan in place. So in 2017, Presence Health was the first covered entity to receive a resolution agreement for failing to timely report a breach. The Chicago-based health system was 45 days late in providing notice of breach of PHI on 836 patients. Their resolution amount was almost $500,000. This can be significant depending on the size of your organization. However, the other consequence of this is they were put on a 2-year corrective action plan. I am not sure what is worse. Corrective action plans can be very time-consuming, and they can require a lot of time and energy and resources to adhere to the requirements. 2 years for a corrective action plan is already bad enough, but in some situations, depending on the infraction, they can go up to 5 years. I'm not saying a breach would or could result in a 5-year corrective action plan, but I wouldn't take any chances. So another example of an organization that failed to properly notify HHS, Centara paid the Office for Civil Rights over $2 million as a settlement after the hospital failed to properly notify HHS of a breach and unsecured PHI. So here's a little background on Centara. They are comprised of 12 acute care hospitals with over 300 sites throughout Virginia and North Carolina. In April of 2017, they received a complaint, HHS received a complaint alleging that Centara had sent a bill to an individual containing another patient's PHI. However, Centara reported this incident as a breach affecting 8 individuals because they concluded incorrectly that unless the disclosure included patient diagnosis, treatment information, and other medical information, no reportable breach of PHI had occurred. However, OCR's investigation determined that Centara mailed 577 patients' PHI to wrong addresses that included patient names, account numbers, and dates of service. So get this, Centara then persisted in its refusal to properly report the breach even after being advised of their duty to do so by OCR. So a word of advice, I would take whatever OCR tells you and recommends and take it very seriously. Since the OCR got involved, this is by the way, they did a little more digging and also determined that they failed to have a business associate agreement in place with Centara Healthcare, and that was an entity that performed services for them. Finally, Centara Hospital, they have agreed to a corrective action and, again, to pay over $2 million. Hopefully that's helpful. So I'm going to turn it back over to Greg to talk a little bit about what happens after a data breach.
Thank you, Ray. So we have now covered the before, the during, and we'll take a look at some of the things that could possibly happen after a breach. The effects of a breach incident are not always immediately known to the organization. Some of those effects or the result actions could take quite a while to become known to the organization or to surface and be aware of the types of situations that have happened. It's important that the organization continues to demonstrate their commitment to the privacy and security of PHI to all of the stakeholders. After a data breach as well, many issues that are made known to you are things that should really be recorded and reviewed and continued into the investigation process. It's very important that you monitor the status of the affected individuals. So for those individuals that you have identified as being a patient individual involved in the breach, and you have notified those individuals, You may well hear from them by reporting back to your helpline number or in some other way corresponding to you. And it's important to track that type of information that they provide. You want to know and record the number of affected individuals who report that they are a victim in some way. Also, that's also one of the items to use to help know whether or not you need to utilize any kind of recovery services, such as credit monitoring or credit restoration services. It's also important to review and consider and take a look at any potential for reputational risk. The risk could be actually to an individual, or perhaps individuals or other entities perceive that type of reputational risk or harm. Some of the types of stakeholders for this type of thing can be patients, employees of the organization, investors, vendors, various accreditation bodies, and also the state and federal regulators. Looking at and assessing any needs for either your existing cyber liability insurance, or perhaps at that time you begin to make determinations and plans for future cyber liability insurance. You want to assess those risks and weigh those risks of obtaining the insurance or not obtaining the insurance with the potential benefits of what the insurance can cover. Your needs will determine whether or not you need to pursue that type of coverage. A lot of times, the services for breach notification, the expenses that are incurred for the various notification types, and the services for credit monitoring and credit restoration, as well as getting consulting companies or perhaps your legal or outside legal counsel to assist in the breach incident, can be covered by the insurance plan. However, in most cases, the insurance coverage the insured will come up with the panels that are developed to include the individuals or entities that they will be having to provide those services on your behalf. Now I'm going to talk about a few examples that have occurred that affect an organization and involvement with the media. The media can play a very important role in getting information out about the breach, and I think most of us would certainly agree that there are many days or weeks that happen that we pick up the paper, we hear on the news, or in some way are informed of an incident that has occurred. However, involvement with the media can also have outcomes that add to the already bad situation for an organization. An example of this is with the Memorial Hermann Health System. Memorial Hermann is located in the greater Houston area, and they had agreed to pay $2.4 million to HHS, and they also needed to adopt a corrective action plan because of the violations that occurred from the privacy rule. In this particular incident, in September of 2015, a patient came to one of the Memorial Hermann clinics, and they allegedly produced fraudulent identification to the office staff during registration. The staff alerted the appropriate authorities of law enforcement about this incident, and the patient was subsequently arrested. That particular disclosure of PHI that was necessary to notify law enforcement and have that situation under control, they are permitted under the HIPAA privacy rule and are considered permissible disclosures. However, Memorial Hermann published a press release about the incident, and this press release had been reviewed and then approved by their senior management. And in the press release, they listed the name of the patient in the title of the press release, as well as details of the incident and other PHI. And in addition to that disclosure of the PHI, Memorial Hermann failed to timely notify and document the sanctioning of any of the workforce members that were involved in the incident and the disclosure that was made about the patient information. In this case, and what has been happening recently, when OCR does publish their resolution agreements on the website, many times in the press release, there will be comments made from the director of OCR or a member of their senior staff. With this incident, the director of OCR, Roger Severino, has a quote, and he mentioned that senior management should have known that disclosing a patient's name on the title of a press release was a clear HIPAA privacy violation, and that would include swift OCR response. It's important to know and have this case in the background of our mind thinking that while we can cooperate with law enforcement, and we need to cooperate with law enforcement without violating HIPAA, we must be extremely vigilant about the types of information that we're providing to law enforcement and the reason and the causes that we're using to provide that information. Another example that occurred about the media involvement with a breach from a covered entity involved an allergy practice that was located in the state of Connecticut. Allergy Associates had 4 locations across the state of Connecticut and had to pay $125,000 to settle the disclosure and resolution agreement with an incident. In this case, one of the patients of the practice contacted a local television station. And the reason they contacted the news station was to talk about an issue they had between the patient, and a physician within the allergy practice. That reporter attempted to contact the physician for comment, and the doctor did speak to the press, and the doctor disclosed the information about the patient to the reporter. The investigation that was conducted from OCR found that the doctor's discussion with the reporter was found to be a reckless disregard for the patient's privacy rights, and that disclosure had occurred after the privacy officer for the practice instructed the physician to either answer the press's questions with no comment or not respond at all. And even with that advice and the guidance from the privacy officer, the physician elected to still speak to the media and did disclose PHI on an impermissible basis. And in this case, as well as with some of the other examples we've given today, Allergy Associates failed to take any necessary disciplinary action against the doctor or any corrective action for that filing of the impermissible disclosure. This is also one of the areas to be sensitive to in formulating policies and procedures, both for breach incidents or any type of HIPAA compliance, because it is a requirement that the organization's covered entities and business associates do have a sanction process in place to handle violations of the HIPAA privacy and security rules. In this example, we're going to switch from the basic media to social media. Social media, as we all know, is a very commonly used platform, which has a lot of advantages. It has a lot of strength for marketing and can effectively and quickly reach a lot of people with a lot of good information. However, that same type of platform can work against an organization if it is not handled appropriately or the safeguards are not applied from the privacy rule. In this example, there was a dental practice known as Elite Dental Associates, and this practice had a complaint filed to OCR from a patient that alleged that the dental practice had responded to a media review that was posted on Yelp. And this social media review, by responding to it, the dental practice disclosed the patient's last name and details of the patient's health condition. The investigation conducted by OCR found that Elite had certainly impermissibly disclosed the PHI, not only of that patient, but of multiple patients. And that response was in other reviews on the Elite Practices Yelp review page. And in addition to the impermissible disclosure, Elite was found by OCR to not have policies and procedures in place regarding the disclosure of PHI, and including for those vehicles such as social media interactions, but also the practice did not have a notice of privacy practice that was in compliance with the privacy rule. And again, comment was made by the OCR director and offered the comment to state that social media is not the place for providers to discuss patients' care. And doctors and dentists have to think carefully about patient privacy before responding to these type of online reviews. At this time, I'm going to turn back to Ray, and he's going to make some discussion about the business associate agreements.
Okay, thanks, Greg. I just happen to have years of experience negotiating BAAs, and so as we switch gears, we're going to talk a little bit about when they're necessary and the obligations of a business associate agreement. So if you are a covered entity, then HIPAA requires your organization to enter into a business associate agreement if your business associate creates, receives, maintains, or transmits PHI for the purpose of performing certain functions or providing services to the covered entity. BAAs have many purposes. They should outline that they need to appropriately safeguard the PHI. They should spell out what is considered permissible uses and disclosures of PHI, and as I mentioned earlier, your BAA should address responsibilities and liabilities in the event of a HIPAA breach. It should also define the timeframes for reporting a breach to the covered entity. As you can imagine, if you have several business associates, managing this alone can be very time-consuming and challenging, especially if they're in different states and have different reporting timeframes. So here are some tips for you to consider for your business associate process. Develop your BAA approval process and include the appropriate subject matter experts, such as your privacy officer, your legal department, key leadership, and even perhaps your purchasing department if necessary. Although your internal process to handle, approve, and negotiate business associate agreements may vary, it's vital to have the right stakeholders involved. Once the business associate agreement is signed, keep in mind you will be held to those terms of that agreement. So ensure everyone in your organization is on the same page and agree to the terms prior to signing. Also, this may sound simple, but it's very important to maintain an updated list of all your business associates. Believe it or not, sometimes determining who they are actually can be challenging. Some things I've done in the past to help identify business associates would request from finance a list of all the checks, for the last year that have vendor checks that have been paid. So some tips to maintain your list would include the names of the business associate, the contact information, as well as the service line provided. In addition, it is very helpful to list out the reporting requirements on your list. One last piece of advice, if you are in charge of handling the BAA process, once you determine if you have all the BAAs, your next step is to ensure you have all the current and updated BAAs with those contractors. Finally, review and ensure the BAAs are fully executed. This means have both parties sign the agreement, You might find that you have a BAA, one or two or a few, that are missing a signature. What I've done in the past, I just simply reach out to the covered entity and asked if they had a signed copy of the BAA. Oftentimes, they would have a fully executed copy in their files, and sometimes they would have just one signature. If they didn't have it at all, it has been my experience that they are more than willing to get a BAA in place because potential risk of not having one is too great. So here are some requirements for business associate and their subcontractors. As I mentioned before, a business associate must enter into a BAA with subcontractors if the business associate has delegated a function or service that involves processing, creating, or storing PHI. Keep in mind, although subcontractors may not have a direct relationship with a covered entity, these subcontractors need to have BAAs with the business associate. So I know that might sound confusing, but think of a subcontractor as a business associate of a business associate. Another piece of advice regarding executing a BAA with a subcontractor, I have seen language in BAAs that forbid offshoring of PHI. If you don't contract with any vendor that operates outside of the United States, then you have less to worry about. However, if you do, or if your subcontractor has a downstream subcontractor that does, you will have to determine how and what process to have in place to ensure that particular client's PHI is safeguarded. That can be extremely challenging, especially if you're running one system, CMS system for all your service lines. So if you have, let's say, 100 BAAs and a small percentage have that provision, this can be very challenging to manage. So the last thing I want to try to drive home is the importance of keeping up on local state laws that may affect the stipulations in your organization's business associate agreement. As mentioned earlier, although your state law may not require a BAA to limit your risk, it's advisable to review your BAA template and ensure it addresses both HIPAA and state laws. I found it helpful to simply just put in the BAA to protect all personal information, not just PHI. You might want to consider modifying the definition of breach as well to include breaches under HIPAA and applicable state breach notification laws. It is wise to include a provision requiring business associates to report breaches under HIPAA and or state breach notification laws within a specific period of time so that the covered entity can timely meet its notification obligations under state law and HIPAA. As I mentioned earlier, know your reporting timeframes. You potentially can be dealing with several reporting timeframes for just one occurrence. So if we go back to my example of the team member finds out about a breach on a Monday, reports it to you on a Friday. So the OCR has a 60-day reporting time frame. What if your covered entity has a 5-day reporting time frame and your subcontractor maybe has a 3-day? You're already backed into a corner. So one last item to consider when negotiating BAAs. Be sure you have some type of no-fault provisions included as well. These provisions typically address how and who is responsible to cover costs, expenses, fines, penalties, and other liabilities arising from breaches and violations. So before I turn it back over to Greg for a couple of final examples, if there's any questions within this presentation that we are unable to get to at the end of this presentation, anyone's more than welcome to email me, and if they have anything that that comes up in the future or they have any questions about this presentation. So now I'm going to turn it back over to Greg to give you a couple more real-life examples.
Thank you, Ray. As far as some examples of business associate agreements and business associates in the news, there have been some issues that do involve those, and they're going to be discussed in the next 2 slides. Advanced Care Hospitalist is an organization that had used the services of an individual that had represented himself to be employed by a Florida company called Doctors First Choice Billings. This was a billing company used for physician services. And this individual provided medical billing services to ACH. They used First Choice's name and website, but allegedly without any knowledge or permission of First Choice's owner. A local hospital noticed the information on the website and notified the hospitalist that the PHI was viewable on First Choice's website. An investigation was conducted after a complaint filed with OCR, and that investigation revealed that the hospitalist practice had never entered into a business associate agreement with the individual providing the services to ACH. And the practice had not conducted a risk analysis or implemented security measures or other written HIPAA policies before 2014. And that finding was somewhat significant because that meant that there was 11 years after the requirement date for HIPAA privacy rule requirement until those types of compliance components were put in place from the physician practice. Another organization that had an incident that involved a business associate agreement was a hospital in Colorado that did not terminate a former employee's access into their electronic medical record system. An investigation was conducted at Pagosa Springs Medical Center, and they found that the EPHI of approximately just over 500 patients was disclosed and able to be accessed by a former employee. And there was a web-based scheduling calendar that was not only prominent, but this web-based company did not have a business associate agreement in place with the hospital. There was access into that web-based calendar from the employee who had been terminated, and that information contained the patient's PHI, and all of the information obtained was shown to be after the date the employee had terminated. And again, the information that was provided from a comment back from OCR stated, it's common sense that former employees should immediately lose access to PHI upon their separation from employment. And in this case, it underscores the need for covered entities to be aware of who has access to their PHI and who does not. It's important to know and to follow procedures to terminate user access privileges upon employee separations. Or, in that case, an organization could certainly risk HIPAA enforcement actions. Covered entities also have to evaluate relationships with their vendors and ensure that there are business associate agreements in place when the definition for business associate has been met. At this point, we're going to take just a brief amount of time. There's been some questions that have come into the queue and answer those questions.
Well, thank you, Ray and Greg, for that fantastic presentation. We will now begin today's question and answer session. So just as a reminder, please submit any questions you have by typing them into the Q&A box you see on your dashboard, and we'll try to get through as many questions as we have time for today. We've already had a few questions come through during the course of the presentation, so we'll go ahead and get started with those now. The first question that came through is, if an organization has a breach of patient information and the patients live in different states, do we notify the patients based on our state's breach laws or the state where the patients live? And Greg or Ray, I'll let either one of you jump in and answer that one.
Thank you. Yes, this is Greg. The patients' reporting requirements would be driven by the state or the residency listed of that affected individual. So it's important to know that the requirements from each state where the affected individuals reside, because that would be what would drive the notification process and the timing for those notifications, and even any potential state regulatory requirement reporting.
Great, thank you so much. And we still have questions coming in now, and we'll continue to get through as many as we have time for. We have about 10 minutes left before the top of the hour, so we should be able to get through a few more. The next question is, if your organization is getting a free assessment from a vendor to provide services, do you need a BAA?
So this is Ray, and if there's PHI involved, which more than likely there probably is, let's just assume that there is, a BAA is not necessarily required, but you would be, ensure that you have some type of NDA or other type of agreement, disclosure agreement, or something that is protecting the PHI that's being transferred or looked at, or whatever the case is. But assuming that there is PHI, then not necessarily a BAA, but some type of disclosure.
Great, thank you so much, Ray. And the next question that came through, it has to do with risk assessment. So this person wants to know, it says, you mentioned risk assessment for a potential HIPAA breach. Can you describe your process, the process you use as your risk assessment? And they're also asking for just any other advice or helpful ideas.
That very much is up to what the organization determines to be in their best approach. Many times the risk assessments can be conducted by external companies coming in, working with the organization to provide those services, or OCR has also provided guidance on their website as to what the security risk analysis component should be comprised of. So really, it is more up to the organization to decide what they feel to be the best approach to meet this requirement. But the important thing is to have this assessment done, and in most cases, we see this process be done on an annual basis. Although there's no direct regulatory guidance on this, having the risk analysis conducted, and most importantly, with whatever findings are provided to the entity or the business associate, it's important that those findings are acted upon and in some way documented, that those issues of concern or the findings have been remediated or in some way mitigated with the findings based on the risk analysis.
Great, thank you so much. And we've had a few more questions come through, so we'll go ahead and jump in with those. Greg or Ray, I'll just let whoever wants to jump in with this next one answer. But this person is asking if you can define discovery date. So they say HHS asked for a beginning discovery date and ending discovery date, and they're just wanting to know how you define that.
So discovery date, there is stipulation where it should have been known. So so for the example that I gave with the team member on a Monday under the PHI, she technically discovered it, so that's the discovery date. Now let's just say you did some type of audit on a Wednesday and you were able to go back and see that that previous Monday the PHI was sent to St. Joseph or Joe's Garage, whichever it was. We should have known that on a Monday, and that's when the clock would start ticking. Hopefully that's helpful.
Yeah, thank you so much for that clarification. And it looks like we have time for at least one more question before we wrap things up today. So this person is asking for any suggestions on how to determine the appropriately safeguards by the BAA. Does that question make sense to you, Greg and Ray?
I'm not really sure. Can you repeat that again?
Yeah, no problem. I think that they're asking about the appropriately safeguards. If that's not something that, it might be the terminology we're using is a little different. So I'll go ahead and move on to one last question. This person's just wanting to know over your overall assessment of how well organizations are prepared to respond to a breach. So just what you're seeing, any trends as far as, just healthcare organizations in general, and how much work they have to do, and how well they're prepared.
This is Greg. I'll take that question. I do find, and I have worked with, certainly in my previous career, have worked with many organizations. And for the most part, the organizations have done a pretty good job of being prepared. Where there sometimes can be areas to look for, sort of look under the hood, so to speak, are in the areas of policies and procedures with the revisions that were made even, several years ago with the omnibus rule. Some of those may not always make it into the currently used policies and procedures. And the other area of vulnerability that I see tend to be in the area regarding where the patients reside and the notification requirements. If you have affected individuals, the question that was posed earlier is an obviously awesome question, because it does happen frequently that's a question posed, and organizations can be a little unsure of the state laws to follow or how to access finding out what the particular state requirements are, and sometimes feel that they only need to report based on the state law requirements of where they reside. In other words, where the covered entity resides, and that's what they follow. But it's important that organizations are prepared to know and understand what the privacy requirements are for each state where the affected individuals reside.
Thank you so much. And it looks like that's about all of the time we have for questions today. But before we close things out today, Ray or Greg, do you have any final thoughts you would like to share with everyone?
I would just like to say, first of all, again, thank you all very much for attending this, and hopefully this information will be something that can be helped both to just validate what already is being done at your organizations, or in some way maybe have given some thought stimulation to some things to look at differently, and go in and explore your regulations and talk with your internal leadership, as well as your in-house counsel or external outside legal advice, whatever it is, just to make sure that you have things positioned in the best possible approach that you can, because all of us know that it's really important to be prepared to safeguard and validate that we have the processes in place to be able to protect one of our most valuable commodities in our work, and that is the protected health information of our patients, our clients, and those that we serve. So again, thank you very much for this opportunity, and we appreciate your attending the session. Thank you very much.
Great. Well, I want to once again thank you, Ray and Greg, for your excellent presentation, and the whole Ensemble Health Partners team for sponsoring today's webinar. Please enjoy the rest of your day, and we look forward to having you join us for future webinars.